Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. I'm really excited to introduce you to my guest today, and you'll notice that our set looks a little bit different as we're filming here in Wilmington at New Hanover Regional Medical Center, and mostly to accommodate two of our guests who are surgeons and quite busy, so we've decided to shoot here. Our first guest today is Dr. Peter Kane, and he's a cardiothoracic surgeon with Novant Health Heart and Vascular Institute, Wilmington. And next, we'll meet with Dr. Jeffrey Beecher, a neurosurgeon with Novant Health, New Hanover Regional Medical Center. And finally, we'll talk with Stephen Hoven, the Vice President of Revenue for Novant Health, New Hanover Regional Medical Center. So stay tuned as we welcome you once again to HealthWatch. Please welcome our first guest, Dr. Peter Kane. Dr. Kane, thank you so much for taking time out of your day today. I know how busy you are.
It's my pleasure.
We appreciate having you here. I'd like to introduce my guest to the community. So
Sure.
Tell me a little bit about yourself, your education, your background.
Sure. Well, I grew up in New York in Westchester County, just outside of New York City, and went to medical school there at New York Medical College. And after that, I went to Miami my wife and I went to Miami for 5 years, where I did my general surgery training at the University of Miami Jackson Memorial Hospital, which was busy and exciting.
I bet.
And then in 2003, we moved to Charlotte for my cardiac surgery training under Dr. Robercheck at the Carolinas Medical Center.
Yeah.
Yeah.
That's great.
Wow,
Great.
it seems like it was yesterday, but.
Well, speaking of yesterday, how long have you been here?
So we came to Wilmington in 2006, summer 2006. So that's about.
Does that make you a local or not? In Brunswick County.
You got to ask the local. I don't know.
In Brunswick County, I've been there 23 years, and I'm still not a local. I don't know how long it takes.
Probably not, but I'm trying.
So, tell me, how did you get into heart surgery? Was that always your dream?
Well, I really always was interested in surgery, and actually when we went to Miami, my thought was that I was going to be a trauma surgeon. I went there because it was a super busy trauma center, and but it got exposed to heart surgery very early on, and it really had a big impact on me from the beginning. Just the technical aspects of it, and also there's a satisfaction in seeing patients really get well, and that was one of the most rewarding things that I saw about heart surgery, is that you did an operation and somebody got better and felt better, and so that was sort of it from the get-go.
Oh, that's great. That's a great story. Okay, I want to get a little bit more specific. So let's talk about coronary artery disease.
Sure.
How does that affect patients? What would be this?
Well, typically coronary artery disease is really, try to break it down to, in its simplest form, is really a plumbing problem. You have arteries that are delivering blood flow to the heart muscle on a constant basis, and when they're obstructed by plaque or thrombus, the delivery is insufficient, and so that can be either a subtle thing that's growing over time, or it can be an acute thing like a heart attack that brings you to the emergency department. So we deal in coronary artery disease in terms of reconstructing it. There's lots of different ways to approach that problem. We're sort of the end of the line, if you will.
I was going to say, so by the time it gets to you, it's surgery.
Typically, yeah, and typically we see people who have already been through the process of hopefully it begins with a discussion with their primary doctor and a nice slow workup with their meeting a cardiologist and getting a series of tests. But typically, by the time they see me, they've been diagnosed with multi-vessel coronary artery disease, meaning typically more than one or two arteries are blocked.
How about valvular heart disease?
Sure,
is that similar, or is that?
It's very well. It's similar in that it's the heart valves are an essential component of cardiac function. They perform a slightly different job. They're really controlling the pathway of blood flow from the inflow into the right heart to the lungs, back to the left heart, and back into the primary pump, the left ventricle, and separating the left ventricle from the aorta. So there's 4 primary valves in the heart. We typically tend to intervene in one way or another on 2 of them. We have an integrated program here, a structural heart program that really looks at valves in detail and tries to find the right pathway for patients, whether it's the least invasive or percutaneous options where we're replacing an aortic valve on a catheter, or some of our colleagues like Dr. Lewis is putting a clip on a mitral valve to direct the blood flow properly. Or we decide that the best option for the patient is surgery, and sometimes there's multiple reasons that surgery may be a better option than a percutaneous approach, and there's many times that a percutaneous approach is more ideal to a surgery, and we just try to tailor the right approach for the right patient.
There are many surgical techniques or procedures done here at Novant Health, New Hanover Regional Medical Center. What's the most common type of heart surgery here that you or Dr. Marks?
So Dr. Marks and I do, our most common operation is coronary bypass surgery. He and I have been dedicated to doing what is referred to as total arterial bypass, which is we use arteries to replace arteries or fix arteries, and in most cases we're using at least 2 or 3 arterial bypasses. In the past you may have been familiar with using an artery from the chest and some veins from the legs, and in the last 5 years we've really steered towards total arterial bypass, and most of our patients are receiving that. The reason we do that is because the arterial bypasses tend to have better longevity over a long span of time, and so we think that's a big benefit for patients. Also, not going into patients' legs as frequently anymore has been a big bonus, and that gets people up moving faster and sort of takes that element out of it.
I wanted to talk to you about heart attack prevention. That's a biggie. I know, diet. I'm always talking to my husband about stuff like this, but I'm sure you would rather operate on a person who's never had a heart attack or before they're in the throes of one. And let's talk about how to have a healthy heart. How do we keep from getting to need you?
Okay, well that's a long that's a long question, but in general it's a lot of common sense, and really healthy lifestyle is very important. And number one is removing environmental risk factors, which are the primary one we see is obviously still, believe it or not, tobacco abuse. We still see tons of people that are still smoking. Diabetes is a big one, and diabetes is and diabetic control is super important, and working with the primary doctor to make sure that your blood sugar is tight is a very important component. Finally, exercise and diet is a very important component, and there's more and more evidence, and I won't go into the details, but there's more and more evidence of a plant-based diet being a very important component of risk reduction for coronary artery disease. And we have an excellent program here, the Ornish program that the hospital has developed along with the Ornish folks, and it's a great program that goes over all of those things: lifestyle, risk reduction, diet, exercise.
Well, there's just so many more questions, but unfortunately we're out of time. I appreciate you being here. It's been a pleasure, my pleasure to have you here, and I hope you'll come back.
It's my
We'll
pleasure.
come back to Wilmington.
I'd love to come back anytime.
Okay, you just pick the topic.
Oh, sounds great.
Great, thanks so much.
Thank you.
Please welcome our next guest, Dr. Jeffrey Beecher. Dr. Beecher, thank you so much for coming today. I know how busy you are, and I really appreciate your time.
My pleasure, absolutely.
It looks like you've been working already, so I won't drag this on too long for you. So tell me a little bit about your background. Where did you grow up, and where did you go to medical school?
I'm from Des Moines, Iowa.
Really?
And born and raised there my whole life until went off to college. Undergrad was at Miami of Ohio, and then I went to medical school at Toro, Nevada.
I'm from Ohio.
Oh, okay. Yeah, very nice.
Originally, yeah. Well, what drew you to neurosurgery?
When I was at Miami of Ohio, I took I was in an advanced biopsych course, and we were doing brain dissection, and I realized that my passion was actually brain anatomy and surgical aspects of the brain rather than the kind of physiology and psychiatric components of it. And so I totally changed directions, and that was that. I never looked back.
Really? Oh, that's amazing. That's a great story. You not only have one fellowship, you have two. Is that correct?
That's correct.
And what are they, other than the brain surgery?
Yeah. So my first fellowship was at UT Southwestern in Dallas, Texas, where I trained with one of the world's most renowned neurosurgeons for open cerebrovascular neurosurgery, which is blood vessel problems of the brain and spine. So we're talking about like brain aneurysms, something called brain AVMs, which is truly like a ball of worms in the brain, and other blood vessel problems. And then my second fellowship was at Buffalo, at University of Buffalo, where it's probably the world's most well-regarded place for endovascular neurosurgery. And I was very fortunate to be there with some of the really big names in stroke rescue and minimally invasive treatments for brain aneurysms and other diseases of the brain and spine.
So how long have you been here in Wilmington or at New Hanover Regional Medical Center?
4 years now, just over 4 years.
Yeah.
Yeah, it's gone by quick.
Yeah, I know you were on the show early on. You hadn't been here too long when you were on our show before.
Yeah.
So. I know that Novant Health New Hanover Regional Medical Center is one of the few facilities that has a 24/7 neuro, I have to get this right, interventional coverage to treat patients with neuro or cerebrovascular emergencies. That is a mouthful.
Yeah.
So why is that so important?
Well, it's really important because these are time-sensitive illnesses, meaning when somebody has a stroke, every second counts. When somebody has a brain aneurysm rupture, every second counts. So it's really important to have an institution like this that can do 365 days out of the year, 24/7 coverage to intervene on these problems when they occur, because there's a phrase we like to use, time is brain.
Oh.
And so the faster you get to us and the faster we get everything back to normal and opened up, the better outcome the patient most likely is going to have.
Well, tell me a little bit about that process. What if the patient is in Brunswick County? How does that happen as quickly as possible? I know AirLink and
Vitalink, yeah.
Vitalink.
They are amazing. And
I know they
can't
are.
tell you enough. I can't talk about them enough. They were here before I got here, so I can't even take credit for what they do at all.
Yeah.
I wish I could, because they're amazing at what they do, and they get the patients to us so fast that it makes it so that our job and what we do is effective, and we are very appreciative of them, and our community is lucky to have them.
So they would typically pick them up at Brunswick Medical Center. The patient would initially be transported to Novant Health Brunswick Medical Center, and AirLink is stationed there 24/7 now.
Yeah. So what's really cool is that we have this artificial intelligence program called Viz IA.
Yes, I want to ask about
Yes. So when Brunswick, Novant Brunswick has a stroke patient they're concerned about, they activate their process, and the patient gets a special CAT scan with contrast that shows us the blood vessels, and it goes straight to my phone.
Oh,
I don't have to wait for a radiologist to read it or anything else. The ER doc doesn't even have to call me. I get the image right away, and I'm telling them, just like this morning, one came through, and I said, all clean, doesn't, nothing that I need to intervene on. And the ER doctor, gave me the thumbs up and said thanks, and then told me the story of the patient, and it looked like something that could be handled there. And just the other day, we had the exact opposite, where it was like, we have a problem, this needs to come, and Vitalink, AirLink brought them right over, and we took care of it.
Yeah. I think we talked about when you were on the show last time, we talked about those protocols that are in place now and how you've worked with the emergency departments in the area and how everybody's on the same page, so to speak.
Yeah, we've done our best to get out to every ER that we can and to all the different systems and just to make sure that our protocols that we like to embrace in our system, because we're very proud of our system's pathway, we're trying to bring that out everywhere else so they can mimic what we do and get patients to us as fast as possible.
Well, talk to us a little bit about NHRMC's 17th Street Campus Neuro Tower.
Yes, well, this is something we're very excited about, very excited about. And we are going to be blessed with a tower that is dedicated to neurosciences and neurosurgery. So we're going to have dedicated neuro ORs with 2 dedicated neuro biplanes, which is where we treat stroke and brain aneurysms. And it's going to just bring what's already an amazing neurosurgical team up to another level. The neurosurgical care that we already provide is tremendous. I mean, we have some of the best robotic spine surgeons in the world. We have some of the best minimally invasive lateral access surgeons in the world. And we have excellent complex spine surgery. And I'd like to say that we have excellent skull-based brain tumor surgery, because that's my forte as well, as cerebrovascular disease. And we already are at this very high level, but this is going to make it so all the other systems and doctors and teams that are ancillary to neurosurgery have a home. So we can really bring neuro care to another level that's just never been experienced in this region.
Right. You mentioned other types of brain surgery, and so I'm curious, we've talked a little bit about stroke, but tell me about some of the other procedures that you do.
Yeah, so there's brain tumors, which obviously, unfortunately, we have to deal with, and patients get those, but we also have brain tumors that are very complex, and we call those skull-based brain tumors. And so these are tumors that are located in a very challenging location in the brain at the bottom of the skull. And in Dallas, when I did my first fellowship, it was also in becoming an expert in getting to these hard-to-reach places in a very safe and efficient manner. And so we are really proud to have this skull-based program here where we can treat these really complex brain tumors that typically couldn't be treated in this region. And now our brain tumor program has just gone through the roof and totally changed the amount of patients we're able to reach, and certainly giving our community the ability to keep patients here instead of having to go elsewhere.
Well, there's so many different procedures and what have you. How many neurosurgeons do we have here at New Hanover Regional Medical Center?
There's 6 of us. We actually just merged into one team, and so there's 6 neurosurgeons that completely cover each other and work together, and really blessed to have Doctors Alcina, Meelan, Huffman, Thomas, and Brown, as well as myself here, and I'm very proud of our product.
That's awesome. I also believe you all have your own assistants, your own practitioners.
Yes, we each have a PA that works directly with us. That is an excellent extension of us and really makes it so we can be in 2 places at one time.
Yeah, and it makes it, I think, more comfortable when you have a buddy, when you have a partner.
Absolutely,
that's
absolutely.
pretty good. Was there anything that you would like to add before we close in terms of neurological signs and symptoms?
Sure, absolutely. So with regards to stroke and brain aneurysms, the thing that most people just need to understand and remember is that if something's off, the answer is never to go sleep it off. If you have weakness or numbness or tingling that's just not right, you got to get to the ER.
Well, thank you so much for being here. Thank you for what you do, and I can't wait till the tower opens because you're going to come back as my guest.
Oh, excellent. I'll be there. Thank
Great.
you.
Thank you. Please welcome Stephen Hoven, Vice President of Revenue. Stephen, thank you so much for being on our show today.
Thank you
It's a
for
pleasure.
having me.
It's a pleasure to meet you. I haven't had the opportunity yet. So tell me how long you've been with Novant Health New Hanover Regional Medical Center.
Sure, I've been with the organization for 2 years now.
And what is your role with the medical center?
I am the VP of Revenue Cycle, so basically I'm in charge of the billing and the collections and the registration and the medical records area.
Oh boy, that's my least favorite. Finances is just another language.
A lot of people feel that way.
Yeah,
so
and I hate to see the bills come in because I'm like, who's on first? I don't know what this means.
I understand. We get that a lot.
Yeah. Well, you're here today primarily to talk about the very generous charity care program that Novant Health offers. And now with the integration of Novant Health and New Hanover Regional Medical Center, that charity care policy is now offered at New Hanover. So I would love for you to talk to us a little bit about how that's going to help the patients here in Wilmington.
Sure. I think we got to talk a little bit about how that program works. So the first thing is that Novant Health patients that earn less than 300% of the federal poverty guidelines are entitled to 100% write-off.
I know, that is amazing.
Yeah. So federal poverty guidelines basically consist of, are based on family size and income. So I want to use an example. I think it's the best way to do this, right?
Yeah, much easier.
So a family of earning $83,000 of four are entitled to 100% write-off if they follow through.
To me, that just blows my mind. I think that is a huge benefit.
Yes.
I mean, $80,000 in 4 people is not huge, but still, to have 100% of your health care taken care of.
Yes.
Now, would that include doctor bills and hospital bills?
Yes, our agreements are with our physicians to also participate, and they are also required to take 100% of the write-off.
Talk a little bit about some of the ground rules. How do you get to participate in this program?
Sure. I think to start with, the program benefits individuals and family members who are unable to access health care coverage through their work or other sources. So recipients generally are uninsured and have limited health insurance coverage. Also, recipients are unable to qualify for other programs to help them with their medical savings, and they have limited, very limited savings. So that's where the program really begins, and that's how we start looking at providing opportunities to our population.
So how do you get involved? Do you have to fill out an application? Do you?
You know, there's a lot of different ways to get involved and to ask. One of the ways is that we send out bills to our patients that have that information on them so they
Okay.
can contact us.
Oh.
Another way is that we have team members throughout the organization that can allow to provide or connect resources for our patients. And then we also have financial counselors who are trained to actually help walk through the application process with the patients.
And the financial counselors are located here in the facility?
Yes. I think with the more robust services that we're offering through the financial assistance program through Novant to us here at New Hanover Regional Medical Center, we have been able to demonstrate an increase in the number of patients that we served with the program. I'll give you an example. In fiscal year 2019, we provided approximately about 4,000 patients with financial assistance. In 2020, it went down, it decreased, but due to the pandemic, and it went down to 3,000. Since the inception in 2021 of the Novant policy for financial assistance, we have served over 6,000 patients already.
Already.
In 2021. So that's a dramatic increase.
Yeah, very much so. I know that it's a wonderful thing in Brunswick County because we have so many underserved patients in that area, and it's just been a huge bonus for them. And what was your threshold before Novant Health? Was it at 200%?
Yes, it was 200%.
So that makes quite a difference.
It makes a heck of a difference. I think the great thing that I'm really proud of the program is, there's so much about access to healthcare.
Yeah.
And there's barriers to healthcare. And one of the biggest barriers in my experience in working in this field is cost. So many times patients will delay their care because of cost.
Yeah.
But with this program, that's not the barrier anymore, right?
Right.
So I'm excited because of that. We are actually hoping that we can provide access to everybody through this program, and I think that's really important.
Yeah. This program, along with the free clinics that are going up, the Michael Jordan clinics and such, I think it's just it's remarkable what we can achieve in this area with these services.
I think with Novant coming in and their ability to leverage this type of services for us has been instrumental in our success in being able to identify and provide the services, particularly to access to healthcare, which is really the important thing.
One thing I wanted to clarify now, if a patient has had care here at the facility or one of our Novant Health Medical Group offices, and they get a bill and they don't have the resources to pay, and they come to see one of the financial counselors. Once that process, if they qualify, and once the process is completed, would they continue to get bills, or do the bills stop at that
That's
point?
a great question. The program is good for 6 months. After 6 months, we do a checkup.
Yeah, sure.
And ensure that
Things change.
Yeah, things haven't changed, or if they have, and then at that time we will reevaluate the patient for continuing in the application process. I mean, continuing in the program.
Right. I wonder about the. Do you have to get pre-authorized for a specific procedure that's coming up or anything like that?
No, you just have to ensure that you identify, similar to like if you're coming in for with your insurance information, you have to identify that you have financial assistance, and then at the time of service that process then takes hold and moves through, but you shouldn't be getting a bill. And if you do, you need to call us.
Right. Well, Stephen, thank you so much for coming on and talking about this very important topic with us. I know that the viewers out there will find it extremely helpful, and I hope that we can touch some people that knew nothing about it and maybe need that service.
Yeah, I agree with you. So thank you for having me.
Thank you. We appreciate you spending time with us today. And if you'd like more information about services at Novant Health, please visit our website at novanthealth.org. So be sure to join us next time for HealthWatch.
How much bandwidth will satisfy your home's hunger? The average household now uses 7 wireless devices a day, including TVs, laptops, tablets, and smartphones. HD streaming and gaming can use large amounts of data and slow down speeds for other users. The more devices you use, the more bandwidth your home needs. So make sure you have enough bandwidth. Get speeds up to 1 gig with high-speed internet from Focus Broadband. It's a speed you need to power all your devices. Call today.
In today's world, to move forward, you must constantly evolve. That's why we're changing for the better. ATMC is now Focus Broadband. At Focus Broadband, we're building better technology to connect you to a brighter tomorrow. And while our name has changed, our commitment to giving you the very best remains the same. Focus Broadband. We're focused on you.